Welcome to this interview on the ReMIND project. I have with me here Patrick van Gelder, project coordinator at ReMIND from a consultancy Steppenwolf, and Maaike van Assche, who is a researcher at the project. Both are located in the region of Flanders, Belgium, and at the University of Ghent. So I want to welcome you both and thank you for joining me. And let me start by asking very generally what the ReMIND project is and what it aims to do.
So ReMIND is an acronym which stands for Robotic ePartner for Multitarget Innovative Activation of People with Dementia. And it's a 3-year AAL project with partners in Austria and Romania. And the objective of the project is to develop an assistive robot that stimulates and supports the physical, cognitive and social conditions of older adults. So to achieve these results, we developed several modules that will be available on the robot. For example, a physical exercise module. We created different exercise videos with different categories and levels of difficulty. We developed a biography module with the Curiosity application. This is an application that is developed by one of our partners in Austria. Serious gaming is also part of the content with, for example, memory games, chess, card games, and more. So in recent years, there is growing interest in the use of assistive robots in aged care because they are believed to have the potential to support independence and care of older adults. So as I mentioned before, we have partners in Austria and Romania in the project. And in these trial sites, the robot is tested in different settings. So for example, in Austria, the trials take place in nursing homes. In Romania, the robot is present in a hospital setting with patients that are part of a rehabilitation program. And here in Belgium, the robot is tested in independent living facilities. So it was quite challenging to outline the protocol for the different trial sites, but on the other hand, it can also be considered a strength here that the robot is tested in different settings. So this is short what the ReMIND project is.
Okay, thank you, interesting. And so what are the next steps for the project, or rather what have been the outcomes so far? And how do you measure impact of the outcomes you've reached?
Well, to answer this question, I will start with a short explanation about the pilot trials that we conducted, so it becomes clear how we defined our outcome measures for the big trials, which are now ongoing. So in 2019-2020, we organized the pilot trials with the first prototype of the robot. So participants, older participants and caregivers took part in the study and they interacted for 3 weeks with the robot. So during these pilot trials, different scenarios with the robot were tested, like I mentioned before. For example, the physical and cognitive exercise modules, the agenda system, whether or not the robot was able to move around smoothly in the home environment of the participants. And we used several qualitative and quantitative methods here to obtain feedback from the older adults. And with this feedback, we improved our scenarios and we also reported and solved technical issues that occurred during the trials. And this in order to develop an official prototype of the robots that will be used during the long-term trials. So in short, the results of these pilot trials show that the participants really enjoyed interacting with the robots, and the robot seemed valuable in terms of active engagement, reducing loneliness and meaningful activities. So those were the most important outcomes of these pilot trials, which means that they found the robot to be a great incentive to perform physical and cognitive exercises. The robot increased group interaction, which means that the robot stimulated interaction between the residents during the group activities. And also, the robot seemed to provide a greater variety of meaningful activities. So it's these results that guided us in defining our primary and secondary outcomes for the long-term trials, which have started in October in Belgium last year. So about the long-term trials, this is a 12-month trial, which is now ongoing, like I mentioned, and a total of 40 older participants take part in Belgium. And this is the same amount for the other trial sites in normal circumstances. And we use a crossover design, meaning that we divided our participants in 2 groups, and both will interact with the robot for a period of 6 months. And as I mentioned before, the impact will be measured in terms of active engagement and loneliness. So those are now our primary outcomes, and our secondary outcomes are the physical and cognitive functioning and participation. So the trial will end in October this year. So we are really looking forward to see the results.
Okay, that's very interesting. So that was what has happened already, if I understand correctly. So what are the next steps for the project, and how long will it take to complete the project?
Maybe I can add to this. Maybe I can give some background on what the project is. It's the type of project. It's like Maaike said, it's an AAL project, which stands for Assisted Active Living. It's a European program. But unlike the normal classical programs, you don't get the money centralized from Brussels, but from your local funding agencies. So in this case, the Flemish partners get the money from VLAIO. And the goal of an AL is also that companies are involved, so SMEs. And for the Flemish part, it is Zora Robotics from Ostend, which are the coordinators of this project. So one of the criteria for an AL project is also that the products that have been developed during the project have to be marketed in 2 years after ending of the project. So that's the goal, that in 2 years' time, after the project ends, it will be available for people to buy it. The project is still running for 1 year. Well, at the end of this year, it will finish. And then the 2 SMEs that are involved, one is from Austria, Ovos Media. They have to combine their products in one product. So the robot is also a module that's called Chaosity. That's a kind of a memory historic software program where people can give input about their past, like what was their first date, what was their first kiss, the movies they like, and so on. And in the project is also another software package that's based on AI that extracts information from the Chaosity app, so the history app, and provides personalized information towards the patient. That's why it's, yeah, I think interesting for Sapphire that it's a personalized tool. Mm-hmm. And but that's actually what I want to say about, add to the story of Maaike.
Okay, thank you. So I've already heard mention Austria, Romania. There are partners from those countries. Are those universities, or are those SMEs, as you've already mentioned? So are there other partners involved, and maybe also talk about a bit about what led to the creation of this partnership?
Well, the creation was asked by Zora Robotics to start such a project because they already knew what an AAL was. So they contacted me, and the call of AAL this time was more focused not on research, but really development. So in the late stages, so close to the market, and to focus on the testing of the product. That's why we needed like 3 test sites. So then I also made the Rehabilitation Sciences Department of the UGent to become a partner in this project. I had already contacts with some research groups in Vienna, and there they had contacts with Curiosity, the SME partner in also from Vienna. So in that case, we had already two countries which participated. The criteria is at least 3 European countries. At first instance, we had a Dutch company that was also involved. But since the Dutch ran out of money, we had to replace them by another partner. Then I found a Romanian partner, and these were this was an academic group from Cluj-Napoca in Romania. And we also could include a trial site from Timișoara University to test the robots. Finally, we had 3 countries involved with a mix of academic partners and SMEs.
So I was wondering if you could also talk a little bit about the barriers the project has faced and maybe still faces, maybe in the regulatory sphere or in the financial sphere, and what might be sort of the advice for similar projects starting out in the same area of research.
Like maybe Maaike can start with cultural and regulatory problems.
So this project definitely faced some barriers in terms of regulatory terms. So first we have indeed the cultural differences between the trial sites, which were not taken into account much when the project was written. And as a result, we now conduct the trials in 3 different settings, as I mentioned. Independent living facilities, nursing homes, and a hospital setting, and therefore we doubt whether the results of the trial will be comparable between the different trial sites. Though this is something that must be taken into account a little bit more when working in an international project, because a second barrier that we faced is also the fact that there are different regulations between the countries. For example, regarding the ethical committees. So in this project, the ethical committees of the different trial sites classified the ReMIND system differently, which means that unlike Belgium and Romania, the involved ethical committee from Vienna classified the robot as a medical device. And this meaning that an extended submission was necessary, which required a lot of extra work and therefore caused a delay in the start of the trial for Vienna. But this was not the case in Belgium and Romania. So it's nothing bad, but just something to take into account in international projects.
But it's even worse because we have 2 partners from Vienna. In one, it was not a medical device, in the other it was. So.
And then, of course, we have a last barrier which holds for all the projects, I think, and that was the COVID-19 situation, which caused a 4-month delay in the project. And also, as a result of the measures that are taken, we could not measure one of our primary outcomes, active engagement, because group activities within the facilities were not allowed. So we hope that when the second group starts with the robots, that we will be able to measure active engagement also.
I just want to mention another problem actually of the GDPR regulations, of course. As we mentioned, the people give some private and personal information to the robot. This has to be protected. And this can be also, of course, a barrier.
Okay, thank you for that. Maybe now we can look towards the future. So you have extensive expertise in robotics and applying it to elderly homes. How do you see the future of robotics in healthcare in generally? And then maybe I'm thinking also about expanding this robotic concept to pediatrics or to the cognitively impaired, maybe even towards elderly people living at home, and then you can also provide tele healthcare, consult doctors over this robot through through the internet. Is that something about which you think the field is moving towards?
We do believe that the use of socially assistive robots will be more and more embedded in healthcare, specifically in aged care, especially within the current context, societal context, with increasing staff shortage and, on the other hand, a growing older population. It is believed, for example, that robots will be able to take over routine tasks from the caregivers to reduce their care burden. And there might be more time left for what is needed the most, like more focus on psychosocial well-being of the older population. So with ReMIND, we want to build a solution that leaves the social aspects of care to social beings and supports the aspects that need less of social interaction by a robot.
Another thing that you can do with a robot is you can take the control of the robot from externally. So if you have a robot with, for instance, your parents, and you're worried, you can take over the control of the robot, walk it through the house, and look if they are okay. This has to be, of course, with consent of the parents, but that's a possibility. That's like a tele control of patients or loved ones.
So it is indeed possible to deliver telehealthcare with James in terms of monitoring also, using an application from Robotics that can be provided along with the robot. So for example, the robot can also call for help when he observes abnormal parameters. Okay, so you also asked us about the cognitively impaired. So however our title says dementia, we decided with the consortium to involve people with initial cognitive decline. So this can be both older adults with a diagnosis of mild cognitive impairment or those with subjective cognitive complaints. So our target group has no diagnosis of dementia. Because as no treatment exists for dementia, many studies, including ours, shifted their focus on trying to delay further deterioration on a cognitive or a physical level. And this is also what we try to achieve with the robot in the first place.
Okay, thank you very much. That was a very interesting interview with, on a very interesting subject and project. So I want to thank you both for coming and explaining this to us. Thank you.
Thank you.